Hey, Dr. Ken Starr with the Wellness Group in Rio Grande. I wanted to take a minute to fully explain what is precipitated withdrawal. You've probably heard about precipitated withdrawal, maybe you've experienced it. Here's what precipitated withdrawal is. Buprenorphine, or trade name or brand name Suboxone, has a higher binding efficiency. It's a stronger magnet at that opiate receptor in your brain than any other opiate for the most part. So if you have any other opiates in your system, whether it's fentanyl, heroin, pain pills, whatever, if there's anything bound to that receptor and you take Suboxone, boom, it pulls it off, right? It's a stronger magnet, it's a stronger affinity at that receptor and has much less activity, okay? So precipitated withdrawal is that opiate receptor has opiates on it to some degree, enough that when you take buprenorphine, it's binding it, it's pulling it off, and it's causing precipitated withdrawal. How do you avoid that? One, you have to wait a long time. You have to wait until your full withdrawal, so that opiate receptor is empty, right? This is like a cold drink of water on a hot day. Your opiate receptor is empty, you take that Suboxone and you feel better. The other way you do is you start with very small doses. I have my patients start with 2 milligrams of buprenorphine or Suboxone, 2 milligrams every hour or 2 hours, kind of take until, and then every hour, 2 hours, you take that until you have 8 milligrams, and then you're good. Then you're okay. And then you can just take 8 once a day. You can take 8 twice a day, or whatever you need. But a lot of people think like, oh, I'm allergic to Suboxone because they took it and had withdrawal. That's not allergy. That's just precipitated withdrawal. So you understand that precipitated withdrawal is really the buprenorphine binding that opiate receptor that still has some degree of opiate on it. You're not quite ready, or maybe too much, and then it pulls it off, and it's very unpleasant. When you go into withdrawal naturally, you kind of have a natural off-gassing and you gradually get sicker and sicker and sicker. With precipitated withdrawal, boom, yanks it off all at once. Okay, that's what precipitated withdrawal is. The other misconception, what you need to know, is that it's not the naloxone and the Suboxone that's causing this. So a lot of my patients think, well, if I just take the generic Subutex 8 milligram tablet, I can take it earlier, it won't cause that. You're wrong, it's the buprenorphine, it's not the naloxone. That's a whole different conversation. But it's not the naloxone, trust me. You have to wait till you're in full withdrawal. I tell patients, look, wait till you're totally ready to tap out. Maybe it's 1 day, maybe it's 2 days, maybe it's 18 hours, whatever. You just can't take it anymore. Start with low doses, 2 milligrams every couple hours, build up. You have that first 8 milligrams on board, then you can just do 8 once a day or 8 twice a day or whatever, okay? That's how you avoid precipitated withdrawal. It's very important. It's not the naloxone component, and also not starting too much at once. If you're totally ready, you're super ready, you're like can't wait any longer, you're in full withdrawal, but then you take 8 milligrams, that can make you feel unwell too. And that has to do with different opiate receptor binding types. There's alpha, gamma, mu, other receptors that get stimulated preferentially, and that can make you feel bad. Precipitated withdrawal, that's what it is. That's how to avoid it. Thank you. Please share, subscribe. Dr. Ken Starr, the Wellness Group in Rio Grande. Thank you.